BTAI is unchanged. This is Thursday, the 14th of August, pre-market session. The stock has been showing an immense amount of strength since Friday, the 1st of August. Yeah, since you can see it went from the lows of around 1.29 to where it's currently trading at right now, which is 5.6. It's almost has almost, if you like, 4x since that time. Here we have currently in play, we have a downward projection of 2.61, nothing to the upside. But we know previously, as far back as late August, late April, it had 6.4, 8.35, 9.56. We've actually seen it. We saw it print 8.08 on Thursday, on Tuesday the 12th, 8.08. We'll get to the reason why that happened. Yeah, let's see. Before that, if you go all the way back to early January, it had 8.02, 9.25, 10.01, and it also had downward projection. So the underlying trend here is neutral, but on its 4-hour chart it is bullish. The 4-hour chart, if you like, magnifies the tip of the daily chart. So this is a microscopic view of what is on that daily chart. It's bullish here. It doesn't show. It's not sufficiently bullish on that daily chart. It's pretty much neutral here. There are no upper projections. The same strength we saw that began on Friday, the 1st of August, is magnified out here. No upper projections, but we've seen them already. We've seen the projections, going all the way back to early January and late April. So those are indeed projections, and indeed this 8.01 it printed on Tuesday the 12th, and more on the reason why that happened. So the extrapolation of its 3-period moving average on this 4-hour chart is indicating that weakness will remain in place for today's trading session. And by tomorrow's pre-market session, you might get a bounce, and then after that, by Monday's post-market session, it will continue the downtrend. There's no guarantee that that will be the case, but given that it lost 17.65% in yesterday's trading session, that was yesterday the 13th, the price pressure momentum is still indicating that the stock is still in a robust trend mode. That shows you how much strength it ran up, going from $1.34 as of Friday the 1st till Monday the 11th, no, till Tuesday the 12th. Yeah, so it hasn't, a loss of 17% is not enough to dent the momentum, dent the trend in the stock, dent the trend in its moving averages, especially on this 4-hour chart. So still in a robust trend mode as things stand right now, but it may change if weakness continues to play out. So you probably heard, or rather, this is the reason why it printed an intraday high of 8.08 on Tuesday the 12th. Yeah, it got a fast track designation for BXCL501, also known commercially as IGALMI, a sublingual dexmedetomidine film. It earned an FDA Breakthrough Therapy status for Alzheimer's, the dementia-related agitation, and fast track designation for agitation in schizophrenia and bipolar disorders. Those designations signal that the FDA designations signal the FDA's recognition of unmet clinical needs and allow for potentially accelerated development and review. So So another clinical moment is the Tranquility in Care, which is for Alzheimer's agitation. So a pivotal phase 3 trial, Tranquility in Care, has been advanced to study BXCL501 for acute agitation in Alzheimer's patients within care settings. The trial aims to enroll 150 patients aged 55 plus, measuring efficacy using PEC score changes 2 hours post dose, reflecting prior trial endpoints. Serenity at home for bipolar and schizophrenia agitation. So another phase 3 study, Serenity at Home, is assessing the safety and self-administered use of a 120 microgram dose of BXCL501 in home settings for acute agitation episodes. Okay, so last patient visit was reached on the 1st of August 2021. The XCC, that's the day it began to spike. The stock began to spike, signaling trial completion. Top line results are expected this month, August 2025, paving the way for a supplemental new drug application to extend IGALMI's label to outpatient use. So this trial notably collected data from over 2,200 agitation episodes with more than 200 patients across 22 sites, with a balanced representation of bipolar and schizophrenia cases. So this is expanded. Okay, yeah. So the second issue is what's fueling the investor and social media attention. At home administration potential, the ability to administer IGLAMI at home as opposed to clinical settings presents a major convenience and health of quality and quality of life improvement for caregivers and patients. This potential is resonating with both institutional and retail investors. Upcoming catalysts with top-line data on the horizon and anticipated FDA interactions. Speculation is mounting about possible partnerships, licensing deals, or even acquisition offers, especially given the strong regulatory designations and large unmet market potential. Volatility and short squeeze stock. So the stock has demonstrated high intraday price swings with current price around 5.6. Yeah, it is. That's where it is. Yeah, 5.6 after being as high as 8.08 earlier in the session. That was yesterday, the 13th. That kind of range, especially for a small cap biotech, opens the door for short squeeze dynamics and speculative trading volume. Long-term backers versus traders. Some community members advocate from personal or clinical experience, expressing a long-term belief in IGLAMI's potential, even amid recent dips. Others, however, point to financial fragility, notably cash burn and operating losses in prior reports to temper expectations. So this is a table. Yeah, you can always pause and read. And then final thoughts. IGLAMI program is firing on several cylinders: regulatory momentum, later stage trial progression, and real world utility via at home administration. The imminent top line readout and subsequent FDA activity may significantly influence investor sentiment and strategic interest in the company. At the same time, the stock remains a speculative asset with considerable financial risk and exposure to pricing volatility. Traders should weigh the binary nature of biotech catalysts carefully, while long-term investors might focus on the broader clinical and commercial potential if IGLAMI gains approval for expanded at-home use. So just see what you make of BTAI, and I'll continue to update you. Yeah, thank you very much for watching this video.